let's kick things off with a fact that might just stop you in your tracks. For one of the most common and serious health issues facing our seniors, the huge majority of cases, they just go unrecognized and untreated. We're talking about depression. So today, we're going to dig into the clinical guidelines to really unpack why this is happening and what the path to hope actually looks like. Okay, so to really get a sense of the scale here, just look at this number. In some nursing homes, up to 90% of residents are living with a mental or cognitive illness. Now, to put that in perspective, for the general population, that rate is closer to 20%. So this isn't some minor issue. It's a silent epidemic happening right in front of us, affecting millions and putting a huge strain on our entire healthcare system. And, the stakes here are just incredibly high. This quote from the experts, it isn't just a bunch of medical jargon. Functional decline means losing the ability to do everyday things, like buttoning a shirt or cooking a meal for yourself. It means a stroke that should be recoverable turns into a permanent disability. It means families are pushed to their absolute breaking point. It's this ripple effect that touches every single part of a person's life. So this all leads to a huge, and I mean huge, pervasive myth. That feeling sad, slowing down, losing interest in things, that's just what happens when you get old, right? It's a belief that's so common because honestly, it's really easy to confuse the symptoms of depression with the stereotypes we have about aging. But is it true? Is this just how it has to be? Well, after decades of research, the answer is an emphatic no. Depression is a treatable medical condition, not some kind of personal failing. And understanding this is absolutely critical because it's not something people can just snap out of. We're often talking about real changes in brain chemistry. And the good news is, we have proven treatments, from targeted therapies to effective medications that can restore that balance and give people their lives back. So why is it so under-recognized? Well, part of it is stigma. A lot of older adults grew up in a generation where you just didn't talk about mental health, for fear of being seen as weak or as a burden. But the other reason is that the symptoms can be masters of disguise. So instead of saying, I feel sad, an older person might talk about a relentless backache or constant fatigue that their doctor just can't seem to explain. Okay, so if we can't always look for tears or obvious sadness, what are the real signs? And this is so important, because missing these signs, the consequences can be really severe. Untreated depression can actually make other conditions like heart disease and diabetes even worse. The signs are often different in older adults because, well, a lifetime of experience can teach someone to mask their emotional pain. So it comes out in other, much more subtle ways. Now, what's really fascinating about this is how much it challenges our own assumptions. I mean, think about an older person in your life. Have you ever noticed them pulling away from social events they used to love? Or maybe complaining about memory problems? It's so easy to just dismiss that as, oh, that's just a senior moment, or, well, they're just slowing down. But these are giant red flags. We miss them because they fit our narrative of aging, when in reality, they could be a silent cry for help. And, certain life events are basically like fuel on the fire. When you look at this list, you realize these aren't just random stressors. They often represent profound loss. The loss of a partner, the loss of independence, the loss of a lifelong home. These are seismic shifts in someone's life that would challenge anyone's mental resilience. And it makes this population particularly vulnerable. Okay, so spotting the signs is step one. But what comes next is the crucial part, getting a clear diagnosis. And why is that so vital? Well, because you can't treat what you haven't correctly identified. The diagnostic process is comprehensive for a reason. The body and mind are so deeply connected. A thyroid problem or even a vitamin deficiency can totally mimic the symptoms of depression. So doctors really have to be detectives to find the true root cause. The journey to a diagnosis isn't vague or mysterious. It's a really clear 3-step path. Think of it like this. Screening is the compass, just pointing you in the right direction. The full assessment? That's the detailed map, showing the entire terrain of a person's health. And the personalized treatment plan? Well, that's the specific route that's charted to get them to their destination, wellness. So what is screening exactly? Well, it's basically the first simple check. A lot of times it's just a short set of questions, like the Geriatric Depression Scale, which is designed specifically to ask about mood and energy in a way that really resonates with an older person's life experience. The real power of screening is early detection. The earlier you catch depression, the easier it is to treat and the less damage it does along the way. Now, I know this list might look a little intimidating, but every single item here is designed to help and protect the patient. This is not an interrogation, it's about getting a complete, holistic picture of someone's health. A doctor who's this thorough isn't being invasive, they're being your best advocate, making sure no stone is left unturned to figure out exactly what's going on. There's absolutely no shame in this process. And this is where the story really pivots toward hope. Listen to me on this. A diagnosis is not a life sentence. It's the very first step toward recovery. And recovery is not only possible, it's probable with the right support. Because every single person is unique, the pathway back to wellness has to be unique too. There isn't just one path. So the two main pillars of treatment are therapy and medication. You can think of cognitive behavioral therapy, or CBT, as a way to sort of retrain your brain, to identify and challenge those negative thought patterns. Interpersonal therapy, or IPT, that's more focused on strengthening relationships and navigating conflict. And sometimes when brain chemistry is really off balance, medication is the tool that levels the playing field, making it possible for therapy to actually work its magic. And this table just brilliantly illustrates that treatment is always about using the right tool for the right job. So for something like an adjustment disorder, which is a strong depressive reaction to a specific event, like a big move, therapy to build coping skills might be all you need. But for severe major depression, the clinical evidence is crystal clear. The most effective approach is combining medication and psychotherapy. The key takeaway here is that the plan is tailored to the person, not the other way around. So what's the end game here? The goal isn't just to feel a little less sad. The clinical goal is full remission. But what does that actually mean in real life? It means having the energy to play with your grandkids again. It means picking up an old hobby you used to love. It means laughing freely at a joke. It means feeling like yourself again. So let's recap. We've established that this is a massive, often hidden problem, but it's one that is absolutely solvable. We know it looks different in seniors, but it's totally diagnosable. And we know it's highly treatable. But getting from that diagnosis to remission, that isn't just on the doctor. It's a shared responsibility that really falls on all of us. Everyone has a role to play. For families, education means learning how to start a gentle, supportive conversation. For healthcare professionals, it means seeking out specific training. And for all of us, it means talking openly about this stuff. Why? Because silence is the greatest ally of this illness. It thrives when people are too ashamed or too afraid to speak up. Now, if there is one fact from this entire explainer that I really want you to remember, it's this one. When it comes to effective treatment, older adults have a response rate that is similar to younger adults. Let that sink in for a second. I'll say it again. Age is not a barrier to recovery. This completely shatters that cynical myth that it's too late or not worth it. There is every reason for optimism. So here it is, the core takeaway. Please burn this into your memory and share it with someone you care about. Depression is not a character flaw. It is not an inevitable part of getting old. It is a medical condition, and just like other medical conditions, it responds to treatment. Remembering this one simple thing, it's everything, because it's the key that transforms shame into action. Which leaves us with this final thought. How do we build that world? It doesn't start with some giant policy change. It starts small. It starts with you asking your father not just about his knee pain, but about how he's really feeling. It's checking in on an elderly neighbor who you know lives alone. It's volunteering at a local senior center to combat that isolation. We normalize this one conversation at a time, creating a world where mental health is just health. The power to create that hope, it's in our hands.